Bismillahirrahmanirrahim. Now this time I'm going to explain you about the S.A.R of morphine. Okay, so S.A.R means structural activity relationship. Okay, it means when we do some modification in the drugs, in the structure of drug, so whether the activity is increased or decreased. So that we're going to see in the medicinal chemistry. So I will draw the structure of morphine, then I will explain you about it. So you see this is the I will draw the structure. This is the benzene ring, and here, this is the cyclohexane ring. This is the furane ring. This is the cyclohexene ring, and this is the piperidine ring. Okay, so here is OH group. Here is OH group. So this is the structure of morphine. Okay, this is the A ring, this is the B, this is C, this is D, this is E. So A is morphine ring. Okay, B is cyclohexane ring, C is cyclohexene, and D is piperidine, and E is furane ring. E is furane ring. So this is the structure of morphine. Okay, so if we do some changes, if we do some change like this, if you know that actually the activity of this morphine, the pharmacological activity of this morphine, it is related to these structures. It is based on this hydroxyl group. Okay, it is based on this hydroxyl group. Again, this is the phenol hydroxy group, and this is okay, this hydroxy group. Okay, if you see the numbering, we can do the numbering here: 1 2 3 4 5 5 6. This is the 6 hydroxy group. Okay, so first it is, and it will depend upon this 7 and 8 double bond. Okay, and it will depend on this N methyl group, nitrogen. Okay, and it will depend upon the aromatic ring, and also the ether link. So if you see, if we see that the pharmacological activity of morphine, it depends upon this hydroxyl phenoxyl group and 6 hydroxy group. Okay, and it depends upon the double bond between 7 and 8 carbon, and it depends upon the nitrogen substituents, and it depends upon the ether linkage, and it depends upon the aromatic ring. So these are the factors which determine the activity of morphine. Okay, so if we do the changes, if we do some modifications and see whether the activity decreased or increased, so this we're going to see actually in the field of medicinal chemistry. So first we see this. Okay, this hydroxyl group, it is required, this hydroxyl group, it is actually required for binding of mu and copper receptors. It's required for binding of mu and copper receptors. So it is this hydroxyl group is seen in all potent agonists, opium agonists. Okay, now if we this hydrogen, if this hydrogen, it is converted to, if this hydroxyl group, it is converted to methoxy group. Okay, methoxy group, then it will yield then it will yield codeine, and codeine is having decreased activity as per the morphine. So codeine is less potent than morphine. Okay, so this was the first factor. And similarly, if this hydroxyl group is converted to OCH3, it will yield heterocodeine, and activity is increased than morphine. Okay, so this is the what we are going to study in the. And also, if you see this, if this hydroxyl, if we do the modification like this, if we put acetyl group here. Okay, if we put the acetyl group here, CH3, and also here CH3, it will yield diacetyl morphine, that's called heroin. And heroin is 2 to 3 times potent than morphine because it will increase the lipid solubility, so it can penetrate through blood-brain barrier. So this is what we are going to study in the this medicinal chemistry.